I would also like to, at the start, express my thanks to our three sponsors. The two gold sponsors, CMHC and BC Housing, and our silver sponsor, Retirement Concepts. This is the first time that we have had sponsors for Friesen Conference, and one of the reasons for that is because we could see that this was a topic of great interest and that we were going to have a bumper crowd. So, with no further ado, I would like to call Elizabeth Tang from CMHC, who is going to chair our opening session, and to invite the other two speakers to come up to the head table.
Thank you very much, Gloria, and thank you very much, SFU, for having CMHC to be part of the great event. Good morning and welcome. CMHC, for those of you who are not familiar with us, we are Canada Mortgage and Housing Corporation. We are Canada's national housing agency and a Crown corporation. And CMHC provides information related to housing matters, from buying and maintaining a home to adapting a home to meet the changing needs. Today, it's with great pleasure that I'm going to introduce the first speaker of our morning session, Dr. Gloria Gutman. Dr. Gloria Gutman developed and directed the Gerontology Department and the Gerontology Research Center at Simon Fraser University from 1982 to 2005. She served 2 terms as president of the Canadian Association on Gerontology, was president of the International Association of Gerontology and Geriatrics from 2001 to 2005, and currently is president of the International Network for Prevention of Elder Abuse and a member of the World Health Organization's Expert Advisory Panel on Health and Aging. In 2007, she was awarded the Order of British Columbia. In 2010, an honorary LLD by the University of Western Ontario. And in 2012, a Queen Elizabeth II Diamond Jubilee Medal by the Canadian Association on Gerontology for her work in gerontology. She is author, editor for 23 books and monographs and over 180 scholarly articles, reports, and chapters on seniors housing, long-term care, health promotion, elder abuse, aging and technology, and seniors emergencies. Today, Gloria's presentation topic is Boomers, Zoomers, and the Super-Centenarians, Changing Demographics and the Mature Adult Housing Markets in Canada. Please welcome.
We all know that Canada's population is aging, but of particular note is the fact that the 85 and over group is the fastest growing group of all. The numbers will double by 2021, and what we're seeing around the world, as well as in Canada, is more centenarians than ever before. And there were almost 6,000 of them in 2011. As you see, the vast majority are females. The guys haven't caught up with us yet, although life expectancy is increasing for both males and females in Canada and around the world, despite the fact of the prophets of doom who all said, oh no, that wasn't going to happen. Some of the 65 plus are frail. Others are healthy and very active, and this was a group who in 1984 went across Canada on a bicycle tour, and this was one of the first studies that we did here at the Gerontology Research Center in following them as they undertook their journey. It's important to note when you talk about seniors that some are wealthy. The politicians would like us to think that all are wealthy, but some are not, especially unattached older people. The poverty rate has dropped dramatically since 1980, but there still are 6 or 7% of couples age 65 and over who are at or below the poverty line, and poverty rates for unattached persons tend to be higher, and depending on how the counting is being done, could well be as from 15 to 25%. It's important to remember when we talk about older people that use of long-term care and other health services tends to be concentrated amongst the oldest of the older population, and even within that group, a small proportion. So there's a small proportion of people at any point in time, 7% who require care in a long-term care facility. That's at any point in time. There's about another 10% who are living at home with major restrictions on their mobility. That leaves, ladies and gentlemen, 85% who can do most of the things they want to do most of the time. And that's really important to remember. We want to ask the question, if 7% live in institutions, where do the rest live? The vast majority, 93% of older Canadians, live in private households. This is a table you probably have not seen before. It's one that I constructed from some new Stats Canada data coming out of the 2011 census. And I'd like to direct your attention first to this column, which is the total 65 and over group. And as you'll see, it's separate numbers for males and females. But the really interesting thing about this table is that it says that about 65% of males, 56% of females live in single detached houses. The next most popular housing for seniors who are living in private households are low-rise apartment blocks. And after that comes high-rise apartment blocks. And it might interest you to note that even amongst the 85 and over, some 18% of older women in the 85 and over group are living in high-rise apartments. That was really important. That's important to note. And the reason that I put this table together was because I work in a variety of areas. I'm a generalist. And I do work in emergencies and disasters and seniors. And so we did a study of older people living in high-rise apartment blocks to find out what they would do in the event of a disaster. And we picked one that was a natural for Canada, and we did the study in Ontario, and that was an ice storm. And the scenario was, if there was an ice storm and your power went out for 3 to 5 days, what would you do? And we were very surprised when we talked to the women who were living in high-rise apartments in what's called a NORC, a naturally occurring retirement community. So they'd moved in before the buildings. The buildings were not designated for seniors, but over the years, the buildings aged and so did the residents. So it became a naturally occurring retirement community. We asked them what they would do, and the vast number didn't have a clue and basically said the managers will look after us. Which is really, it was a wake-up call for me and should be a wake-up call for all of you, that you need to think about where you're living, and you need to think about, especially if you're in an apartment block, what's going to happen if the power goes out and how the devil you're going to get down and or get the services that you need. And, those of us who work in the disaster area, this is an important question, because although when you see on television, and you may remember the pictures from the tsunami in the Indian Ocean, they focused on nursing mothers and on little kids, and on the Scandinavians that happened to be visiting in Thailand. In actual fact, what the disaster statistics tell us is the vast majority of people who die in disaster situations are over the age of 65. The vast majority. So we need to think seriously. We're in an earthquake zone. We could have an earthquake. With a bunch of us living in apartment blocks, do we have a clue what to do? And we should be thinking about that. This table is also very interesting in showing us that about 4% of men and women live in semi-detached houses, in row houses, in apartments, in duplexes. So we've seen in this city a growth of these townhouse complexes. Where I live in Oak Ridge, all along Canby and Oak Street, the single-family dwellings are being replaced by these multi-family complexes of townhouses. So this is the first data that I had seen that gave us a substantial number of people. So these are substantial proportions. If you add the three groups together, that's about 15% of the 65 and over population living in that kind of housing. Very small number in movable dwellings, and a very even smaller number in what's called other. So we need, as in setting the stage for today's conference, what I wanted to draw attention to is the shelter care continuum. So we have independent market housing that is occupied by about 90% of the population 65 and over. Supportive housing is a category that in British Columbia tends to be targeted to low-income people, and there is a little bit of support provided. I would draw your attention to the website for assisted living, because if you are not familiar with it, you should get familiar with it. British Columbia has the distinction of being, I think, the only province that very clearly defines and regulates what it calls assisted living. And this is for people, they used to say people who could self-direct their own care and or who were living with someone who could direct their care. And it offers prescribed services, so you can get some assistance with your activities of daily living, but not a lot. And so it's quite clear what a person can get and what they cannot get in assisted living in this province, much more so than in other jurisdictions. So when you read American literature or you read literature from other provinces, you want to compare it with what we call assisted living in British Columbia. And at the other end of the far end of the continuum, we have residential care, which is your nursing homes, your licensed care facilities, places where there is professional staff and where you are getting 24-hour oversight by healthcare people. So you want to think about the fact that you've got independent living, you've got these supportive and assisted living, and then over here is residential care, and beyond that would be your hospitals. A key theme is that, as it says here, contrary to the images of the doomed sayers and those who propose apocalyptic demography, which is the idea that the sky is going to fall in because we've got more and more people living to be old, we want to recognize that people 65 and over come in a variety of shapes. They're short like me, or they're tall like the two Andrews. We have multicultures, multi-ethnic individuals in this country. We have people varying in socioeconomic status. As we said, some are wealthy, some are not so wealthy. And people are different in terms of their functional status, meaning what they can do, right? So there's health and there's functional status. Functional status is your ability to look after yourself and to do the things that you like to do. And so with different kinds of people, different shapes and sizes, we need different kinds of services and different kinds of housing. And diversity of anything is going to increase in the future. Already we have people with HIV/AIDS who are living long enough to be old. One of the projects that I'm involved in is end-of-life caring in the LGBT community. And it's a big need that has emerged, because if you think about it, about half of the people who are gay and who are over the age of 60 are living with HIV/AIDS. They never thought they'd live to be old, so they didn't save or plan much for their retirement. Well, folks, they're with us. And we're going to see a lot more people who are surviving, people with different kinds of mental or physical disabilities. We're also going to see more centenarians and super-centenarians. These days, those of us in the gerontology business, we differentiate between a plain old centenarian, a semi-super-centenarian, and a super-centenarian, right? And these super-centenarians are men over 105, women over 107. So what are the implications for shelter and service planning? It's that we really do need a range of housing and tenure options to meet the needs of 4 groups. And you see the 4 up there. And how many of you in this audience would call yourself Zoomers? I think we're going to see a lot more of them, because as the baby boom group move through the age continuum, they're not going to be happy looking like or being like Whistler's mother and sitting quietly in her black costume and in her rocking chair. As far as I think most of us are concerned, we want to dance, we want to drink, we want to party, we want to travel. And we want to have the kind of housing that we want to have and that will make us happy. So on that note, I would like to end and just tell you, last year's Friesen conference focused on residential care. We talked about taboo topics in residential care. I've given you the link so that afterward, if you want to go and look at the 22 conferences that preceded this one, you can. But this year, clearly, our focus is on the housing end of the shelter care continuum. Thank you.
Thank you very much, Gloria. And now I'm very happy to introduce my colleague, Sarena Teakles. Sarena is a market analyst at Canada Mortgage and Housing Corporation's BC Market Analysis Center. She is CMHC's spokesperson on the seniors housing market in British Columbia, providing commentary reflecting the diverse composition and the unique features of this market. Sarena holds a bachelor degree in physics from McGill University, in addition to a bachelor's degree in finance from Ryerson University. Today, Sarena is giving an overview of Congregate housing, assisted living in Canada, findings from CMHC's annual Seniors Housing Survey. Thank you, Sarena. Please come.
Okay, so thank you very much, Gloria, for your wonderful presentation. I'm going to apologize now if there's a bit of repetition, because like Gloria, I'm going to be talking about the continuum of seniors housing that we do have in British Columbia and that we do see across Canada's 10 provinces. The information that I'm presenting here as well is in relation to our 2013 CMHC Seniors Housing Market Survey. We are in our final preparations for the 2014 survey, which should be released within the month, so within June. So on the agenda today, I'm going to give a brief description about what our survey covers, just because as some of our definitions do change because it is a national survey, it's not in the same context as what we all understand here in British Columbia. In addition, I'll first look at the demand and supply factors that are present within the seniors market, and then show how those factors are influencing average rent and vacancy rates for seniors housing across British Columbia. So as Gloria mentioned, we do have a continuum of seniors residences within British Columbia and across Canada. If you go from province to province, each province unfortunately does call it by a different name. Having grown up in Ontario, I grew up knowing that there's nursing homes, and that's pretty much where the majority of seniors when I was growing up went to live when they couldn't live on their own anymore, other than going, unfortunately, to a hospital where they need that heavier degree of care. But in BC, as Gloria has mentioned, we have independent living, assisted living, heavy care type facilities, and this really speaks to the continuum of seniors housing that's contained within our survey. And if we look beyond that, we also know that there's long-term nursing homes, also in hospitals. And then at the other end of the spectrum, we have shelters and hostels as well, that all are home to people who are aged 65 and older. Now, as I mentioned, our survey is really focusing on this middle group, so residences for senior citizens. So this is our independent living, assisted living, and our heavy care facilities, or facility living. And out of the entire Canadian population, out of seniors that are living in what they call collective residences, represents about a third of that population. So it's really quite a small segment of the entire collective housing segment. So to relate this back into the BC definitions, back when BC used to do its own senior survey before we nationalized, we used to call independent with support and assisted living as part of congregate residences. And that is in contrast to care facilities, where it did provide that extra degree of care. Now, to make this sort of a standardized report, they've called the spaces sort of two things. One being standard spaces, wonderful generic name, and it's defined as seniors residence spaces that contain no more than 1.5 hours of care per day. If you go beyond the 1.5 and have to pay for it, then you're on the other side, which we call heavy care. So I'll be using these two terms within my presentations. So standard spaces is really your independent and assisted living, and your heavy care is where essentially your residential care where you've got more than 1.5 hours. Now, to make our survey even more interesting, they've put a number of other clauses that residences must meet to be included in our survey. This is, again, just to make sure that we have a standard measure of what's included in our survey across the entire province. So there's 5 criteria. 1, the residence must have been in operation for at least 1 year, meaning that it's had time to rent up and properly reflect market vacancy rates and rent levels. It must offer an on-site meal plan. It doesn't require people to subscribe to it, but must offer it. It cannot provide a high level of health care to all residents. So this would exclude types of centers that are all heavy care. So for it to be in our survey, it must have at least 1 independent or assisted living unit. And it must offer a rental unit. So again, our survey doesn't include items such as life leases or owner-occupied units that are designated for seniors. And it must also have at least half of its residents that are aged 65 years or older. So if everybody can keep all of that in mind, I don't blame you if you don't. I'll get on to some of the demand and supply conditions that we're seeing in the market. The sole demand factor that I see in the seniors market really comes from the seniors population. If we don't have seniors, then there's not going to be a demand for seniors housing. And right now, in conjunction with the boomer population coming up, we are seeing, and people over 100, I can't say centenarians apparently, we are seeing the population growing. In BC, it was estimated in 2013 that there were roughly 340,000 people aged 75 years and older, and this was up nearly 2% over the estimates from 2012. So given we're seeing an increase in the population, it's natural to expect that there would be an increased demand for seniors accommodations as well, especially for those in the 75 years or older age group. One reason why we focus more on the 75 plus group is that the average age of most people in the residents that we survey is over 80. So we figure that this is a more representative age group that is being targeted for these types of residences. In terms of looking, keeping that 75 age group in mind, we like to take a measure called the capture rate, which takes the number of seniors residence spaces within our survey and divide that by the number of people aged 75 years or older. It sort of gives us an idea of how many seniors within that more common age group are present within what we're surveying. And in British Columbia, that captures about 8.2% of the people that are 75 years or older. Not saying that everybody is 75 years or older, but just it gives a relative measure. It's one of the higher capture rates in Canada, the highest one being in Quebec, which is at 17.6% of their 75 plus age group. But again, it's also not the lowest point. Most of the Atlantic provinces do have capture rates below 5%. So with the growing demand of seniors wanting seniors housing, how are they being housed? Are we seeing an increase in supply? And the answer to that is yes. If we look at what we've surveyed over the past 5 years and seen how that supply of seniors housing has grown, we see that there's been over 3,000 new independent or standard spaces that have been added over the past 5 years. Between 2013 and 2012, there was a lower rate of growth in terms of the supply, and especially in relation to the population growth. And we'll see the impact of that in the next couple of slides. But the important thing to note here is that, yes, demand is growing because the seniors population is growing, and builders are building to accommodate that additional demand. So in terms of how that's affecting vacancy rates, in general, in 2013, vacancy rates declined across the country. There are certain provinces that did see their vacancy rates increase or that were flat. And in British Columbia, the 2013 vacancy rate was 11.4%, and that had fallen from, I think, 11.9. It was on the high side, close to 12%. Compared to the other provinces, Alberta is very close at 10.2%, and both BC and Alberta are above the provincial average if we take the average across all 10 provinces. That's not to say, though, that people don't want seniors' residences, though, because you might think, well, 12% or 11.5% vacancy rate seems quite high. One thing you do have to remember is that our survey is primarily focused on market housing. So this is people who are doing private pay, they don't have the subsidies. So as soon as you get a subsidy, which one would you rather be paying for? One that costs less or one that costs more? So we're really capturing here the portion of the seniors population that are in seniors residences that don't have that subsidy. So in terms of looking at how the vacancy rates are spread out across the province of British Columbia, the vacancy rates are the highest in the Lower Mainland. So this includes all of Vancouver, all of the Fraser Valley. And most of that is because they have the highest number of seniors residences. They capture about 40% of the total spaces in the entire province of British Columbia. And this is contrary to what we thought of, everybody goes over to Victoria for the place where the just wed and nearly dead, if I may use that quote. Yes, people do move to the island to retire, but most of the units are here in the Lower Mainland. Vacancy rates also on the Vancouver Island are also comparable to the Lower Mainland, although a little bit lower, probably reflecting the increased demand there. The one interesting area that I found from our 2013 report was in the interior, where we actually saw vacancy rates increase year over year. And by talking to some of the local retirement homes out there, I found out that there's been an increase in supply. It's just been a steady increase in supply and growth out there of new spaces. And the demand for those spaces hasn't been quite met. Seems like so they're building a little bit ahead of what they're expecting for demand. And as such, the vacancy rates have gone up. Other BC, don't like the word other BC, but unfortunately to roll things up it had to be called as such. That includes the Kootenays and North Central BC, so probably about 60% of our landmass here. It's starting to see seniors complexes. Places like Prince George and Kamloops are starting to see seniors complexes being built and seeing them being filled. So the seniors universe is evolving and it's creating more spaces throughout the entire province. If we move on to average rents, keeping in mind that we do have a situation in BC where we have more demand than new supplies coming online, we are seeing average rents continuing to trend upwards. It's in 2013, the average rent for a standard space, meaning no subsidy, was about $2,700 per month. If you notice the trend across the country from BC, going west to east, from BC over to just to Ontario, the average rents do decline. Then all of a sudden they jump in Ontario to over $3,200 per month. Quebec seems to be its nice little island oasis at $1,500, and then average rents tend to go back towards Manitoba sort of average levels out in the Atlantic. Part of the reason why there is the difference in rents across the country is relative to property values. In BC, as we all know, we have wonderfully appreciative property values, which does come into effect when places price their retirement units. Ontario does have the same issue, especially in Toronto, in terms of their land prices, cost to build. It does bump up those average rent levels that are passed along to people living in seniors' residences as well. And if we break down BC in terms of average rent levels as well, similar to the vacancy rates, Lower Mainland and the island are very comparable to one another. Again, the Lower Mainland, because of their higher prices, they are seeing higher average rent levels. But at the same time, there are a couple other factors that are coming into play into the average rent levels as well. One trend that we've noticed in our report is that more seniors' residences are adding more amenities. They're adding more social events that are directly linked to the building to make them more accessible to their residents. Some of the ones that caught my eye in the 2013 report were transportation, so providing on-site transportation services for its residences. And on that note, I've recently heard about a new project that's being contemplated over in West Vancouver where they're offering to drive their residents around in Bentleys. I don't think that's the norm, but for $10,000 a month, I would hope it'd be a Bentley. Beyond that, they're adding things such as movie theaters and the internet, as we all know, and become more familiar with it. It's becoming more a necessity to be able to remain current and communicative with our family and friends. So in summary, we're continuing to see the seniors market grow, evolve, and provide more amenities to meet the changing needs of its residents. As Gloria has pointed out, most of you seem like you're going to be Zoomers, so it makes sense that the market should be changing to meet your changing needs and desires to make it a place where you do want to live when you decide to live, or if you decide, I should say, to live in a residence such as these. The vacancy rates and demand levels, vacancy rates and average rent levels in our 2013 survey did reflect the fact that there is an increased demand for seniors housing because of the growing population. And going forward, we should see these rent levels to continue to increase modestly, at the same time as seeing additional supply brought online as well. So that does conclude my presentation for this morning. My contact information is here on the screen. If you do have any other questions, please feel free to contact me. And just as a reminder as well, we do have our 2014 seniors report coming out. So if you do have any key points you remember from my presentation today and want to compare to our new report coming out, feel free to peruse our website. So thank you very much.
Thank you very much, Sarena, for the excellent overview. I'm going to introduce you the third speaker of the morning session, or the first morning session before coffee break. She's also my colleague and a dear friend, Karen Ungerson. Karen is corporate representative at the Canada Mortgage and Housing Corporation's Affordable Housing Center. As a marketing professional with CMHC, Karen has worked in the BC housing industry for 25 years. She is active in promoting the federal government's role in housing to a wider range of corporate clients and is currently focused on building partnership with municipal governments, the nonprofit sector, and the private industry to develop affordable housing opportunities across the province. Karen's previous public relations roles include working with the BC provincial government and with British Columbia Television during Expo 86. Her experience in corporate communications is complemented by a journalism degree from Concordia University, Montreal, and a professional background in training, project, and diversity management. Karen's presentation today is about affordable housing for moderate-income seniors. Please welcome Karen.
Thank you so much, Elizabeth, and it's just such a great pleasure to be here today, actually. On the stage, I'm so happy to come after our esteemed academic colleague, our esteemed analyst, because I am none of those things. I am a storyteller, and the way I wanted to actually start today's presentation is to share with you, although I'm not a housing expert specifically focused on seniors, I have parents, and my mom, I suppose, would be kind of like the model, the poster child for the start of my presentation, because she and my dad were living in Quebec. My mom is now 93. She was living in Quebec in her late 70s and realized that the winters of Quebec were no longer conducive to keeping a single family home. Her children had long since left home. She was living with my father at the time, who, bless his soul, was a lovely individual, but also very high maintenance. And women, you know what I'm talking about out there, just saying. So my mom actually said to my dad, can we move? Can we leave Quebec, where we'd raised our children? Can we make a move to the coast where Karen, our daughter, is, who has just become a single parent? My dad was having none of it. Absolutely none of it. He had his cronies, he had his community, he had some work that he did. And so he said, no, I'm not going. And my mom at 79 years old packed up and left the home and my father after 60 years of a relationship. I will eventually get to the important stuff, but okay, for a second. So my mom now presents herself to me, Karen, I'm coming west, I need a home. Well, she was living on a fixed pension. She was living on a fairly low to moderate income, probably more on the low side, to be perfectly honest. I lived in North Vancouver. She wanted to live somewhere close by. Initially, I said White Rock, which of course is not close by. But I had a very close friend suggest, no, Karen, if you are going to be part of her life here in Vancouver, you are going to need to put her somewhere close to you. So we decided West Van. We were able to find her an affordable rental in West Van. Surprise, it was on the ground level, it didn't have an ocean view, and she wasn't driven around in a Bentley. But a couple of years passed, she did very well, she reestablished her independence, felt very good, still in constant contact with my dad. I mean, he was still her husband, she just wasn't going to live with him. And she eventually suffered some mobility challenges, some medical challenges that meant she could no longer live independently. Well, my mom in her infinite wisdom said, I read somewhere about something called a granny flat. Karen, can you build me a granny flat or a granny suite? Thankfully, I had a husband who was a builder. And so quietly, we were able to create a small laneway house for her, connected to on our property, obviously. That lasted for a fabulous 10 years. We were her social life, we were her drivers, we were her support system, and then other cognitive changes happened. And she was, in the last couple of years, actually not forced, but by choice, decided she wanted to live with a community of seniors that she could relate to. I mean, my husband, my kids, our dog, we were a lot of fun. but she had nothing in common with us other than she loved us. So she did move into an assisted living facility and now has suffered some additional challenges, and so we are considering the next phase. Now, the reason I bring that up is to tell you, I am not a housing expert, but I certainly have had firsthand connection to what it takes to work through the various stages and steps that brings all people age 55, 65 moving into the Super-Centenarian that you talk about. And I hope my mom will still be here to be called a Super-Centenarian. So now that we've set the stage, I wanted to share with you that CMHC's Affordable Housing Center works on behalf of the federal government and works directly with private and nonprofit developers to facilitate the creation of new affordable housing across Canada. I should let you know that Canadians are in fact Canadians are fortunate to have one of the best housing systems in the world. Now, a cornerstone of that system, whether it be through our mortgage loan insurance and our securitization operations, or is enhanced by our market analysis or research expertise, or is actually delivered by our Affordable Housing Center, is a shared commitment to ensuring that all Canadians have a safe, quality, affordable place to call home. So my presentation today is going to actually take you into, provide you with some insight into the federal government's role in housing. I'm going to give you a very high-level look at some of our program resources, and then best of all, we are going to go on a cross-British Columbia, cross-Canada tour. Doesn't require getting into a bus. We're going to do it virtually, and I really think that my presentation is more of a teaser for the depth of information you are going to get over this next day and a half. So I'm guessing that many of you are already familiar with the housing continuum. The work that I do is actually centered in that beige, or that grayed out area, my eyes are going, that beige area, dead center. And I need to let you know that affordable housing is not social housing. Basically what we do is we work with housing proponents. They could be nonprofit organizations, municipalities, seniors group, the Lions, the Kiwanis, the service clubs, faith groups, or even like-minded people like yourselves who may be interested in creating a new housing model that suits the needs of yourself, your friends, your families, your colleagues. But before we explore the work that my center does, I do need to take you to the far left-hand side of the slide, which indicates those areas of housing that have devolved to the provinces and territories over the last decade. Now, here in British Columbia, social housing is now directly delivered by the Government of British Columbia via our provincial housing agency, BC Housing, and I know there's a speaker here from BC Housing, I believe later today. Now, that being said, despite the devolution, the federal government through CMHC and our ongoing partnerships with provinces and territories continues to provide significant funding support for a wide range of housing programs to help reduce the number of Canadians, the number of seniors in housing need. Since 2006, the Government of Canada through CMHC has invested about $16.7 billion. Typically, it's approximately $2 billion of annual funding in housing. And last year, $1.7 billion of this annual federal funding was in fact provided in the form of ongoing subsidies so that close to 600,000 individuals and families living in social housing, both on and off reserve, can continue to afford their homes. To drill down to the local level, to British Columbia specifically, that in fact touches on approximately 70,000 BC households, improving the quality of life for low to moderate income Canadians living in existing social housing, including individuals who may be homeless, at risk of homelessness, seniors, persons with disabilities, recent immigrants, and our Aboriginal people. Earlier this year, the governments of both Canada and British Columbia announced an extension to the previous investment in affordable housing, which covered the 2011 to 2013 agreement. And this now solidifies more than 300 million, 150 million from each senior level of government in joint funding for housing over a 5-year period starting April 1st. As was the focus in the earlier IAH framework, provinces and territories, in fact, have the flexibility to use the funding to support a wide range of solutions, including things like new construction, the renovation of existing housing, home ownership assistance, rent supplements, shelter allowances, and accommodations for victims of family violence, all of which can, in fact, touch on the diverse and changing needs of an aging population. Okay. Now our framework, and I think there's been some talk about statistics already, and I really do try and shy away from statistics, but our framework does indicate that approximately 80% of Canadians' housing needs are met by the market, either by our wide range of affordable financing options or through our securitization programs that allow lenders to access mortgage funds. For the other 20% of Canadians in need, that is, their needs are not being met by the market, we work with government and private partners, as I said a moment ago, to help Canadians from all walks of life access quality, affordable homes. Our contributions in this area really does take the form of either funding, consultation, support, financial tools that not only helps preserve the supply of low-income housing, but also allows for the potential development of new housing moving forward. And as you can see, the particular center that I work for, affordable housing has been at the core of what we do for the last 20 years. So before we take a real look and dive into the kind of housing that's available already in your communities here in BC and across Canada, I just wanted to, oops, that slide was supposed to be hidden. Wait, let's go back. Oh, I hit the wrong slide. Okay, that's never good. Okay, so don't look at the slide. The slide is gone. What I wanted to share with you is some of our funding or financial incentives that are available to all housing proponents to create affordable housing in the communities where you live, work, and grow. Our first program is called Seed Funding. Our Seed Funding program consists of a grant and an interest-free loan up to a maximum of $20,000 when combined that will help to support activities carried out in the early stages of developing affordable housing project proposals. So what we basically do, myself and my team of corporate representatives across the country, is we go out and we meet with housing proponents in communities right across British Columbia who may have land, existing land, they may be interested in purchasing land, and they're interested in getting a concept, a housing concept, possibly for seniors, off the ground. The second level of our funding is called our proposal development funding. It is more geared to paying for some of the soft costs of pre-development prior to the point where that same housing society is able to secure the kind of financing that they will need to actually build that property. And then the last form of our financial support actually comes through a mortgage loan insurance tools, which I'm really not going to get into, but basically we do have mortgage loan insurance products that enables both private developers to create affordable rental housing as well as home ownership projects that will not require the full level of eligibility criteria if somebody was to go simply through a private lender and not have their project actually insured by CMHC. Now, before we turn over to the slides of the, oh lordy. But before we turn over to the slides of the different projects across the country, because this is a lifelong learning session, I just wanted to draw attention to some of the products that we have, or resources rather, that we have on our website, so www.cmhc.ca. If you're interested in learning more about our financing programs, if you're interested in looking at the vast array of different housing projects that have been created across the country, if you're wanting to determine how you would actually start an affordable housing project, we encourage you to go online, join us for one of our web forums, and certainly explore the vast wealth of information and expertise that CMHC can provide. But What I want to now do is to really take you on a bit of a virtual tour of projects that have been created through the federal government in partnership with provinces, territories, municipalities, and housing proponents like churches, nonprofits groups, seniors groups, etc. So I invite you to join me on a virtual tour of Made in Canada Affordable Housing Solutions. Let's start on Vancouver Island. That should actually be Hustwik, with the K up with the C. There's a problem with the computer this morning. So we'll start our way on the west coast. This is a project located in Parksville on Vancouver Island. It was a joint effort of a lot of partners, but of significant value here is the fact that the Parksville Lions Housing Society came to the table with just over $500,000 in land. And by leveraging those dollars and working closely with the municipality, they were in fact able to create a 33-unit development that actually has a combination of 28 affordable units as well as 5 market units. Now, this was a project that replaced an existing project in Parksville, and just to give you a sense of the price ranges, the affordable units for these in this particular property at time of opening were sitting at about $420 per month, whereas the market units were sitting at just over $900. And this project really did pave the way for future development in that same area, now that the municipality and the regional district identified some new municipal bylaws that would allow them to waive some of the costs associated with developing affordable housing. This next project is extremely interesting in that it was the first micro-housing project for seniors in Abbotsford. It was truly an innovative approach to providing affordable housing because it spoke to the power of both private and nonprofit partnerships. Basically, what we had when this project was first conceptualized were 2 housing proponents at the same place at the same time. Lynn Haven is an existing seniors housing society. They had been housing seniors, I think, for more than 50 years in the Abbotsford area. Their existing project was aging. The cost of maintaining the underutilized site was escalating, and very definitely tenant safety was an issue. At approximately the same time, a private developer called Algra Brothers was exploring a housing proposal to develop a micro suites for seniors. And he already owned a remediated brownfield land, parcel of land rather, in a suitable location for seniors housing. So these 2 partners kind of matched and married, and what resulted, a whole bunch of things had to happen, but what resulted were 64 new units of seniors micro suites. They are 290 square feet. They are equipped with modern facilities, contemporary kitchens, bathroom safety features, in-suite laundry, of course, and built-in features. You know, the kind of features where the desks turn into the dining room tables turn into beds, and the beds fold up into the wall. Though that's exactly what this kind of project looked like. So next up, moving out of the valley and into Kelowna, is a project, now you're going to hear a lot today about the co-housing model, the Life-lease model, the campus of care model. This particular project I call the perseverance model because it took this particular group, the Hope Society of Kelowna, 15 years to get the project off the ground. So the seeds for Apple Valley, so any of you who are doing housing development out there, 15 years is a long time, correct? Yeah. No, not a long time. Okay. At any rate, this particular project came about because of a large land benefactor, or a private land benefactor, who provided a parcel of land to the Society of Hope in Kelowna. It took them a number of years to determine that this particular land was not suitable for seniors housing for a number of different reasons, including it simply wasn't in a good proximity. So eventually, the Society of Hope was able to sell that benefactor transacted land, is that a word? That land donation, and they were able to use the dollars from the sale to actually purchase another property closer to town. I think Luke Stack, who's the ED of the Society of Hope, calls it a AAA location because it's right next to the largest mall in Kelowna. One of the things that was that the land benefactor insisted is that any property created for seniors using the dollars from his land was to have both social and a recreational component included. He wanted to be sure that seniors continued to be socially active and also to be physically active. So what was created was a project. I think it had 72 units. It also included a recreation and senior support center. It has a fireside lounge, a multi-use activity room, a community kitchen, and apparently the gentleman who provided the land was an avid bowler, so it has a 6-lane bowling alley. Okay? And not only the suites, but the other services provided through the recreation center has really created a wonderful community environment. And the Seniors Outreach Society and Interior Health also have offices and offer services directly from this building. So that's another really good news story. But let's leave British Columbia. I'm still good for time, I think. Okay. Let's leave British Columbia. Let's go over the Rockies and into 2 minutes. Okay. It was going to be fast 2 minutes. Let's go into into Calgary. We have a property here which was originated through a faith community. Basically, it's a 42-unit energy efficient unit. It's a mix of both affordable housing and market housing. Again, the developer wanted to be sure that it provided for an inclusive community. It has 12 units that are state-of-the-art, barrier-free for residents clearly with limited mobility. Some of the features include an oversized elevator, a meditation room, heated underground garage, which I guess is crucial in Calgary, and a courtyard with barbecue facilities. One of the things that the developer strategically did, or the architect, was to be sure that he moved people around the building. So he has a lounge and a kitchen for social gatherings on the main level. The second floor has a coffee bistro area, and the third floor has a library with fireplace, encouraging for more tenant interactions. It was created on a parcel of land previously owned by a church, and if you think in your communities, how many churches are you aware of that are sitting on huge parcels of land, a ton of parking, and a shrinking parish? So keep that in mind if you are wanting to get creative and to become a bit of a community advocate for change in your community. Our next project in Ontario, I'll go through very quickly. It's a conversion, rather, of a previous school site. It is a project that's located just in Pembroke, which is about 15 minutes from the Canadian Armed Forces Base in Petawawa. And basically what was created here through a private developer were 18 units, an 18-unit project that had 8 accessible units. A school is a really good site for a conversion because of the concrete floors, the wide hallways and passageways, as well as rooms that typically a one-level school offers ground-level access to both outdoor green space and interior hallways. So this particular project was redeveloped. It was kind of built from the inside, or turned inside out, and it became a one-level townhouse style development with accessible features. Some of the features were customized to meet the needs of the individual tenants who were occupying those suites, including things like extra bright lighting for the visually impaired, as well as strobe light alarm systems for hearing impaired. Okay, Cohabitat Quebec is a project obviously in Quebec, in the city of Quebec, La Ville du Québec, and it's an intergenerational project, and I believe there's going to be a speaker immediately following this session who is going to speak to the co-housing model, but I did want to make mention of the fact that this is a very affordable option for people who enjoy their individual space, but who also want to have some shared amenities, which helps to build community as well as to keep costs down. But I'm not going to say any more about that because I believe the next speaker in. What I do want to just follow up with for my last minute and a half Gloria? Okay, minute and a half. See how I snuck that in? I know, very sneaky. I'm hoping that this works. I have a video to show of our last project that takes place in Newfoundland. And we're going to see if I can do this. Okay.
Friesen has a sense of we need something, we go and work for it and get it. We have a very good group of citizens who are hard workers. Everyone in town is community minded, and that's why we are a striving, go forward town. There was very limited affordable housing for people that are living here now. More than likely they would have had to move at least an hour's drive away to have somewhere to live. And I felt that it was time for us to keep a lot of these people in our community if possible. These are the moms and dads that still stay close to the family and can avail off their family to still help them. Maple Ridge Court is an affordable rental housing project. It's a 10-unit development, well within walking distance of anywhere if necessary. Our units are 750 square foot individual units, slab on grade, high efficiency HRV unit, Interguide 80 standard to make it very, very affordable for our people to live here. All of our units are built off universal design, with one unit being fully accessible.
CMHC got involved at the early stages through our program called Seed Funding that enabled him to access some funds in order to develop a business plan, feasibility study, and preliminary drawings. AHI is the Affordable Housing Initiative through the federal government, through CMHC, and through the Newfoundland and Labrador Housing Corporation.
AHI, the Affordable Housing Initiative, is a great help for a developer. Without the Affordable Housing Initiative program, this would not have been an affordable housing project. The Affordable Housing Initiative funding allows the developer to have the funding up front to go into the project, which you don't have to amortize in your development, which allows you have a much more economical rental rate.
CMHC provides a proponent more than just the funds to go towards the project. We provide our expertise in order to allow them to build a better affordable housing unit at the end of the day.
It was a very good working relationship. They have the experience and long-term history in this type of thing.
I was born in Triton, I lived in Triton all my life. We were hoping that somebody in Triton would construct or build units like this so we could be pretty well secure for the future, so we wouldn't have to move away from our own community. We're very happy with the house, the way it's constructed. You know that the affordable housing, you're paying so much per month.
As being a developer in the community and all over Newfoundland and Labrador, I felt that it was a win-win situation to provide these services to these seniors. I feel very good in what we have accomplished there and have a very good feel about what we achieved.
Go. So that concludes my presentation today. I just wanted to say thank you for the opportunity to be here. Hopefully I've been able to share with you some insight in terms of the federal government's role in housing, but more importantly, the kind of innovations and partnerships and opportunities that you using and moving forward to create for yourselves or for your community can continue to ensure all Canadians have a safe, quality of place, affordable place to call home. Thank you.